being that you've been practicing for so long, how do you look back on the many patients who you may have treated 25, 30 years ago may have passed away at this point? How do you look back now?
Frankly, with a lot of humility. I tell you, the one thing that is important to understand is no matter what your intentions are, no matter where your heart is as a physician, it's a learning process. During the process, patients suffer. You make mistakes, just part of being human. No one is born knowing everything. And you just want to decrease the number of mistakes. You want to decrease the number of people who may be hurt by that process, but really medicine is not a perfect science. And so when I look back, if I were ever to dedicate all these years of work to something or someone, it would be to my former patients. And not even the former patients who have done great and have lived, which would be the majority, but it's the former patients who didn't do well. Because each one taught me something new, each one taught me to be better and to serve the next person in a better way. In fact, one of the reasons that I entered the world of robotic surgery is a patient. Now, unfortunately, I don't remember the patient's name, but I remember the patient. And I think that's an important story too. My life I think, can be illustrated with these little vignettes, but I think they mean a lot. And it's very important to look at these things. I was an intern. As a first year after medical school, young surgeon, just training at the Mayo Clinic. Now you have to understand the Mayo Clinic is the most amazing place on earth in terms of medicine. There's no question that it is unrivaled in all of the world.
Mayo Clinic located
in Minnesota, Rochester, Minnesota. And in those days, there were no other Mayo Clinics. Now there are some branches. But really, the Mayo Clinic in Rochester, Minnesota is a very special place. And the reason it's a special place is that everyone is a master of the art. So surgeons are master surgeons. These are people that when you watch them operate, when you learn from them, it's like watching an artist. Mm-hmm. They're all driven for that perfection. And in that environment of perfection, as a young surgeon, I remember we did an operation. I was involved, I should say, in the operation. I didn't do it. I was just there. In a person who had some lung surgery. And when they had their lung surgery, in those days, we had to open their chest, make an incision. And the surgery went great. There was a tumor, we removed it. Everything went beautifully. But a day later, the patient died. Mm-hmm. And when you look back, the patient did not die because of the surgery. They did not die because of mistakes. They died because of the way their body reacted to that incision. Now, we have come a long way to understand the effect and the stress response and all the hormones and change, and there's a lot of discussion there about what happens when you open the human body, mm-hmm. which really is not a natural thing. Mm-hmm. And that patient died as a result of the cascade of changes that occurred from the incision and not the operation. Mm-hmm. So it was that one example is how that person changed my life. Because from that moment on, the one thing that was important to me is I have to find a way to do surgery without opening the chest. Mm-hmm. Now today, it's second nature. This is 1983. We're talking many, many years ago, long before you were born. But the point is that in those days, that was the way it was done. And then each of those patients taught us that we need to do things differently. So the same operation now is done with 3 little holes with mm-hmm. all our technology. So we have come a long way. And that patient, whose name I don't remember, is the key to my career in robotic surgery. So there have been many like that.